Okay, physiological changes in pregnancy. The uterus enlarges length, depth, width, and by weight, and this is all because of increased estrogen. The uterine wall thickens until the very end of pregnancy, and then it becomes thinner to try to accommodate for those uterine contractions. Volume of the uterus increases from 2 mLs, okay, so think about drawing up 2 mLs in a syringe to 1,000 mLs, okay, and that's to accommodate for that amniotic fluid. Muscle fibers stretch during pregnancy in the abdomen and the uterine wall and are not new. So these are not new muscles. So the uterus is able to return to a non-pregnant state with no destruction of tissue. Because of the larger uterus, intestines are pushed to the side, the diaphragm, so the lungs are elevated, the liver is elevated, the stomach gets compressed, and there's pressure on the bladder. Everything else, because of the baby and the amniotic fluid in the uterus, everything else gets moved out of the way. Uterine blood flow increases during pregnancy because of placental needs. 1/6 of a woman's blood flow circulates through the uterus at any given time during pregnancy. 1/6 of a woman's blood flow. So, if a pregnant lady is bleeding, we need to figure out why, okay? Because it could be very, very serious, and we really need to pay attention to why she's bleeding. We need to take care of it. Cervical changes. Increased estrogen causes the cervix to be more vascular and edematous. A mucus plug forms to seal out bacteria. So you have, okay, so obviously this is an abdomen. I'm going to draw a picture on this just so you can see. So you have a uterus, and then you have the cervix down here. That mucus plug would form at the tip of that cervix to keep bacteria from entering. Increased fluid between cells causes the outer uterine wall to actually soften. So as an examiner, if you press on the outer abdomen and you go internally and you press on the outer uterine wall, it should feel softer. So if the lady's not pregnant, that uterine wall would feel like the tip of your nose. And if she is pregnant, it would feel like your earlobe. It's softer. This is referred to as Goodell's sign. Because of increased estrogen, there's vaginal changes. The tissues increase in size and become enriched with glycogen. The muscle fibers of the vagina loosen. Increased activity of epithelial cells cause a slight white discharge. Increased vascularity of the vagina, just like the uterus, will cause a slight purple bluish discolor, and this is referred to as Chadwick's sign. And I have a slide to hopefully help you remember that. Hey girl, what's up? You seem a little blue today. So this is the non-pregnant uterus saying to the pregnant uterus, I'm not feeling blue, I'm just busy holding in this embryo. pH level of the vagina becomes more acidic during pregnancy from increased glycogen, and this makes it more resistant to bacterial invasion. Breasts of a pregnant lady, because of estrogen, become full, tender, they get larger, and they may be tingly. Growth of mammary, alveoli, and fat deposits throughout pregnancy cause breasts to enlarge. The areoli darken and the diameter increase. A woman may begin to secrete colostrum starting around week 16, but this is not a norm. Blue veins become apparent because of the increased vascularity. The skin, stretching causes rupture and atrophy of connective layer of skin. So there's pink and reddish streaks on the abdomen and thighs that are normal during pregnancy. These become silver lining or stretch marks. If the abdominal wall has difficulty stretching, then the muscles underneath may separate. have a picture of that. So this is actually like a textbook picture where the actual muscles are separating. It's referred to as rectus diastasis. And then here's what it actually looks like on a person. It's pretty easy to spot if you see it. This lady's already had her child, but it looks fairly the same if she's pregnant. Extra pigmentation from a melanocyte stimulating hormone from the pituitary can cause extra pigmentation on the skin. A common place is the cheeks, referred to as a butterfly mask or chloasma. Okay, and this is purposely blank because we're moving on to the endocrine system. So a very exciting thing happens in pregnancy. I'm going to actually attempt to draw a picture here so we can keep up with the changes. But the endocrine system in pregnancy, only time in anyone's life that they will actually grow an organ. Okay, and so we're going to make this uterus small for now. And a pregnant lady actually grows a new organ, and that's the placenta. The placenta produces large amounts of estrogen, progesterone, HCG, human placental lactogen, which will HPL. HPL is similar to growth hormone. It modifies the metabolic state of the mother so it can facilitate the energy needs of the fetus. And it also produces relaxin and prostaglandins. The pituitary gland, which we know is up here, so again, I'm not an artist. FSH and LH is halted because of the increased estrogen and progesterone produced by the placenta. The pituitary increases growth hormone production. Later in pregnancy, it will release the prolactin for the milk production or to prepare for lactation. And the posterior pituitary is responsible for oxytocin, which can stimulate uterine contractions for labor and or after during breastfeeding. The thyroid gland, which is located here, becomes enlarged and secretes increased thyroxine in two forms of iodine. I can't remember off the top of my head. But the increase in these three things can increase a woman's metabolic rate by 20%. Okay, so this could be, if the lady didn't know she was pregnant, the increase in these thyroid hormones along with it causing an increased heart rate and increased perspiration could lead to a misdiagnosis of hyperthyroidism. Adrenal glands. We know they're located near the kidneys, right? They secrete additional levels of corticosteroids and aldosterone. This suppresses the inflammatory reaction and the possibility of the woman's body rejecting the foreign protein of the fetus. So this keeps the woman's body from treating the fetus like a foreign tissue transplant, which that helps. It also helps regulate glucose metabolism, and the increased aldosterone promotes sodium reabsorption and maintains osmolarity in fluid retained, which safeguards blood volume and provides adequate perfusion across the placenta. Pancreas. Increased production of insulin. We'll talk about gestational diabetes later. The increased insulin is because of the increased production of glucocorticoids by the adrenal glands. In pregnancy, though, insulin is less effective because estrogen, progesterone, and HPL are all antagonists, and they're all produced by the placenta. So, if a diabetic becomes pregnant and they were taking insulin because of their diabetes, and say they were on 6 units a day, because HPL, estrogen, and progesterone are antagonists, and they're now being produced in larger amounts in pregnancy, that same 6 units of insulin may not be sufficient. They may have to increase that dose. Decreased insulin effectiveness occurs in pregnancy, and this is so there's a ready supply of glucose for fetal growth. The immune system, there's a decrease in IgG production, so a woman's more prone to infection during pregnancy, and there's an increase in WBCs. This does not mean she has an active infection. It's just in response to the decrease in IgG response, and also we'll talk a little bit later of why the WBCs. Respiratory, increased estrogen causes nasal stuffiness, okay? She feels like she's got a cold all the time. It can also lead to nosebleeds. The diaphragm can be displaced up to 4 centimeters because that baby gets bigger. So this small uterus here becomes very big here. And the baby's head down and happy, but it displaces those lungs up to 4 centimeters. Vital capacity does not decrease though, because those lungs can still expand sideways even though they can't expand down. The lady may breathe a little bit more heavily, 1 to 2 breaths more per minute, and she will feel short of breath. Temperature in pregnancy can slightly increase early in pregnancy from progesterone secretion of the corpus luteum. It's the same slight increase in pregnancy that you have with ovulation. Okay, it's not a 102 would be, okay? It's a 98.3, okay? Cardiac. I'm going to change to my red marker here. This is important. Blood volume. We're going to make a heart here. Blood volume increases 30 to 50%. Okay, let that sink in a little bit. 30 to 50%. Okay, you go and start an IV on a pregnant lady, 85% of the time she's going to have beautiful veins, okay? It's because she has all this extra blood volume circulating in there. The plasma volume increases faster than red blood cells though, so pseudoanemia can occur early in pregnancy, but that will catch up and be normal by the 2nd trimester. Iron needs increase because the fetus requires 400 extra just to grow, 400 milligrams, and mom's extra RBCs that are floating around in that extra volume require an additional 400 milligrams. So moms that get supplemented with iron usually take 800 milligrams per day, right? Where do you think that comes from? From the baby and her extra needs, 800 milligrams per day. Cardiac output, in order to compensate for all that extra volume, blood volume, the heart works harder. Cardiac output increases 25 to 50%, and the heart rate increases 10 beats per minute. Okay? Blood flow to the lower extremities can be impaired from the pressure of this big uterus and the big baby. It can cause varicosities of the vulva, rectum, legs. It can cause hemorrhoids. Increased estrogen causes increase in all your clotting factors. Okay, fibrinogen, platelets, all your clotting factors. Fibrinogen can be increased up to 50%. Okay, so a lady that's pregnant is at an increased risk for clotting. Total white blood cell count increase. Protective mechanism against infection and from increased total blood volume, and a response to the IgG decrease that we talked about earlier. GI system, increased HCG and progesterone, increased estrogen, and decreased glucose all cause nausea and vomiting. Yay! Upward displacement of the stomach, so your stomach's in here somewhere, okay, but it's getting pushed up, the food that you ate, and that cardioesophageal sphincter that's supposed to be closed after you eat, this hormone relaxin relaxes that and it remains open. So both the stomach being up and that being relaxed causes your heartburn. Okay, so your baby doesn't necessarily have hair. That's not the reason for your heartburn. Your intestines get pushed back, slowing your peristalsis and emptying of the stomach. Relaxin and progesterone cause the GI tract to be less active. Increased estrogen cause hypertrophy of the gums and bleeding with brushing. This just makes everybody want to get pregnant, right? Urinary, your total body water doubles. Your urinary output increases by 60 to 80%. Frequency will occur in the first trimester and the third trimester. It will subside in the second trimester. Ureters increase in diameter by 25%. Bladder capacity increases to 1,500 mLs. For musculoskeletal, relaxin and progesterone cause softening of a woman's pelvic ligaments and joints and cause that widening here in order to accommodate birth of the baby.